All right, we're back here at the studio in Cooper Creek Square, about to chat with our first guest, Jen Fanning. But first, I want to give a quick mention of Mountain Grind Coffee, one of our sponsors. A big thanks to them for supporting our show. Jen Fanning with the Grant County Rural Health Network, always a big part of our community up here. Before we get into the nitty-gritty, do you want to indulge in a candy cane with me in the spirit of the holidays?
Oh, sure.
There's one for you and one for me. I just figured we'd get something so that we can really enjoy talking health insurance and Grant County Rural Health. So what do you do at Grant County Rural Health Network?
So our slogan is that we advocate for and support your health, the health of Grant County. So we really focus on access to care because we live in a rural community, underserved community. Just because we're rural, there's mountain passes all around us, and there's certain things that we probably won't ever have here, like open heart surgery. We're not necessarily ever going to have open heart surgery in our community. We choose to live here because it's a phenomenal place, right? But part of that is making decisions about having health care further away. But there are a lot of people in our community that don't have access to a doctor or to a mental health
or even just the knowledge of that they could have, they just don't know how to get there.
Or what's here. And there are also a lot of people who have a lot of chronic diseases, and it's really hard. The healthcare system is so confusing, and it's really, really hard to navigate the system. And especially when you're sick, you're feeling icky all the time. You have, 10 different medications that you have to manage and know exactly when to take them. You have, 10 different doctors. You've got all these side effects.
This is for someone that's really sick.
Really sick, yeah, absolutely. And we have a fair number of people with chronic illnesses in our community. And so we have a program that, our patient navigator program, that helps people navigate the system. And also anytime anybody's experiencing a barrier to care. So they might be uninsured, don't have the money to pay for their co-pays, the transportation, whatever it is. We can help them navigate and remove those barriers to care and find other resources in the community.
What a phenomenal service. And so is this a state-funded program? Is this a federally funded program? Or is it donations from local nonprofits?
Yes.
Okay. Everything, all of the above.
All of the above. We've tried really hard over the past several years to diversify our funding. So we definitely get a lot of our funding from grants and foundations, both locally as well as statewide.
Is that a part of your job, is to be applying for these grants?
Absolutely.
Constantly, I assume.
Constantly, yeah, it's the best part.
Yeah.
And federal, we have federal funding that goes through other places. So for example, we also have health coverage guides to help people enroll in Connect for Health Colorado. And that funding, most of that funding is federal funding that goes through the state that then goes through a partner. So all these, diverse ways that we get the money, a bunch of grants and foundations, that sort of thing.
And how many people would you guys help in a year?
Last year we helped 365 people total, and that's just for our aches, pains, patient navigator, and at the time we had a cancer program. This year we've already helped over 550.
Over 500. And is this throughout our entire county?
Yes.
And our county's what, about 10,000, 14,000?
14,000.
So that's a huge percent of our population that has come and gotten assistance from you, and that doesn't even count all the people that we wish would call you and get assistance.
Exactly, and that doesn't include the health coverage guides at all, anything that they've done. That's just our core programs that we do. So.
Oh, that's phenomenal, because you talk to so many people that get overwhelmed, and they can lead to depression. So many things, because you get financially behind, you're stressed about your health, and you don't know where to go, what to do. So they can call you. There's no $50 upfront fee. There's no, this is a service completely complimentary, provided by our local.
Absolutely. Of course, we always ask for, any kind of donation that the patient can provide. So for example, our aches and pains programs that get people into a healthcare provider, we call it an administrative fee because we really want people to be able to, and people usually want to pay for something. They don't necessarily want it for free. But that's not to say if they can't pay that we will turn them away. Absolutely not. The services are there for our people. We just want to make sure that if they have some money, if they have $5, $2, $10 that they can pay, it helps them feel more in charge and that they're contributing something as well.
All right. Well, we're going to take a quick break. When we come back, we'll talk a little more about some changes in the law, and also we'll talk what is a very favorite subject of every Lifty circle, healthcare. So we're going to be back in a moment chatting with Jen Fanning of the Grand County Rural Health Network, and we'll be back shortly.
Sounds great.